Hello, welcome to For the Young at Heart. We focus on issues and interests to improve the quality of life for our senior citizens and their families. On today's program, we're going to be taking a look at suicide survivors. Now, some of you who might be unfamiliar with that term think I'm talking about perhaps someone who tried to commit suicide but failed. No, we're talking about people who are left behind, the loved ones who are left behind. And I have three guests. I'm going to be introducing Deborah Helms. She's a program coordinator for the Samaritans of Merrimack Valley.
Hi.
Kim O'Brien, who's the training facilitator and a suicide loss survivor. And Nina McDonald, who is a volunteer coordinator for the Samaritans. And we are so fortunate that they could come today. Thank you.
Thank you for inviting us.
This is a heavy topic, I might say, but it's such an important topic to try to educate people. There are myths about this, there are realities, and where would you like to start to begin to introduce this topic to our audience? Maybe you as a program coordinator.
We could, just to give a few statistics maybe, just so people are aware of the prevalence of suicide. In Massachusetts in 2008, which is the most recent data we have, there were 509 suicides in Massachusetts alone. In the entire United States, there was over 36,000 suicides. And when we get to survivors, we usually average, say, the industry standard is 6 people per death, that there's 6 people who are affected by a suicide death. Most people will tell you that's very understated. It's probably more like 12 to 15 people. So if you're talking about 36,000 suicides every year, and a minimum of 12 to 15 people who are affected by that. That's a lot of survivors out there. People just don't want to talk about it.
All right,
so that's why we like to go out and do these kinds of things to get people to talk about it.
Well, I'm so glad that you want to do that so that it comes out into the open.
Right.
When you say 12 to 15, we're talking about different relationships for the one person who has committed suicide. So we might be talking about parents, spouse, children, co-workers,
friends, church people. Yeah, survivors, people who've lost somebody to suicide can be anybody. Family member, distant relative, co-workers, as I said, church people, sports teams, kids, if it's a teen suicide, kids that play on the teams, they're all survivors. Friends, anybody who is aware of or is affected by somebody who dies by suicide is a survivor as far as we're concerned.
So if we accept that, and I'm going to accept that, where do we go from there? How do you start to educate the general public or the people who call you? And at some point, how did you get involved, and how are you doing with it?
Okay. As you mentioned, I am a suicide loss survivor. I lost my brother John, and how are we doing with it? Well, you know what? You deal with it. You do. It is a very different type of loss to grieve. From the emotions of guilt, how did I miss it? What did I see? Many survivors tell us when they come to our support groups that it felt completely out of the blue. For us and for my family, as we learned more, and for us, education is power, as we learned more about suicide and what we know about suicide, it helped us understand John a little bit more and where he was, where he might have been to do this. So 90%, so statistics show 90% of people, all ages, it doesn't matter, demographic doesn't matter, 90% of people who die by suicide have a diagnosable, maybe not necessarily diagnosed or being treated or treated correctly, but a diagnosable mental health issue or substance abuse problem. So when you understand that fact, that reality, then suicide, you understand that it really wasn't a choice. People don't choose to get a heart attack. They don't choose schizophrenia. They don't choose to have a mental health problem. So, just like diabetes left untreated can kill you.
And that's probably one of the biggest myths about suicide is people think they got up one morning and said, I don't like the way my life is going. I think I'll kill myself. It doesn't work like that at all.
Right.
Very, very, does it happen? Absolutely. And are most suicides preventable? Absolutely. We'd be the first to tell you we can't stop every suicide. But because there are such effective treatments for substance abuse and all kinds of mental health issues,
Sure.
It's encouraging those people and empowering those people to realize that there's nothing wrong with them. It's not a character flaw. Doesn't mean they're crazy,
Or weak,
all
or-
are weak or any of that. We need to get those people out there and seek help just like they would for a medical condition. So it's not one thing. We kind of call it like the perfect storm. There's an underlying reason, which is usually mental health. And then it's all of life stressors. The economy has had a huge effect on people over the last 2 years. We've got increased calls. We have a crisis hotline that we run 24/7. Huge increase in number of callers because of the economy.
So they know you're there. We in the
We're
Merrimack
here.
Valley know that you are
Our
there for
tagline is,
them.
you are not
Okay.
alone. Yeah.
That's really good to know.
Yep.
And we will have resources
Right.
and your phone numbers at the end of the program.
Yep.
When you say that it's preventable,
Mm-hmm.
some depressions don't look like depression. Some people who might be walking around depressed, they don't look depressed. Families aren't going to recognize that.
Oh no, many depressed people hide it very well, actually. You would never know unless you were educated as to the warning signs and risk factors, which is what we try to go out there and say, here's some things you need to look for. Doesn't mean they're just suicidal, doesn't mean that they're going to kill themselves. But here, based on research and a lot of other studies, here's some of the common factors that people who are clinically depressed and or suicidal might have. And so we talk about those a lot in great detail so that people understand what to look for. Usually it's after the fact that we educate families, unfortunately. So, they talk to us and they'll say, well, he stopped hanging out with his friends. He used to go out every Saturday night. He didn't do that anymore. And it's not until afterwards when they start talking with us and stuff do we realize what the factors are.
Why don't you then outline some of those factors for our audience right now?
Do you want to start with
Something
that?
that they can look for.
Sure.
Not meaning, like you said earlier,
Yeah.
not meaning that it's suicidal, but that these
Exactly.
are signs of a depression or something else
That's right.
going on.
Right. I think the biggest risk factor that we see is if a person stops doing what's ordinary for them. For example, if it's a person that's always been really outgoing and active in the community and all of a sudden they become really withdrawn and they aren't doing those normal everyday activities for them, that's a huge sign. And that's definitely something that hints that people need to look closer at what's going on and start to begin a conversation of how are you feeling.
Okay.
But then just other things such as eating habits, sleeping habits, moods. If, for example, if it's a person who has been depressed for a long time, if all of a sudden their mood elevates and they seem happy, that's a definite sign, because oftentimes it's when the depression seems to go away a little bit that they have that clarity of mind and that insight of developing a plan. And for teenagers, just another risk factor would be if people start giving away possessions, if they're giving away their iPods or material items, or if it's an elder who's always talked about death and been really open about it, and now all of a sudden they're really closed off, or if they've always been really closed off and now are making plans with you that they haven't before.
I think hopelessness is another big one,
Yeah.
particularly for the elderly. Hopelessness.
Hopelessness, yes.
That burdensomeness. I'm a burden. They'd be better off without me. Unfortunately, it's difficult with elderly, all age groups. It's not very clear cut either way. But with elderly, you don't know if it's dementia. You have a few other things to think about besides depression, and so you have to tease out, is it really depression? Which can be done. I mean, it's not like it can't be done. But if they didn't care, like Nina was saying, about who gets what in their will, and all of a sudden they're paying attention to that, maybe they're thinking about it a little bit more. Hopelessness for elderly is a big,
That's a big
risk
one.
factor.
Just can't see
Isolation.
a future. Just can't even see how there would be a future. That there would
without the pain they're in. Depression is painful.
Yes, yeah. One of the things with the elderly that could be a little bit of a trick right about now is they're all being educated on advanced directives and making plans. And so it might look like a healthy thing.
That's exactly right. Yeah, that's a very good point. Yeah, you're absolutely right.
You know, I mean, it's a massive educational process going
It is.
on.
It is, which is good. I mean, which is a
It
good thing.
Which is a good thing.
They should be educated in a lot. We all should.
Right.
But yeah, and with teens, it's very difficult too,
Right.
just for different reasons. With
Right.
teens, you know, a lot of parents say, "Oh, that's just a teenage thing. That's a mood they're in. That's a stage they're in." It's very easy to just say, give it another name. And so, what we just really want to do is tell people a little bit about what they should be looking for. Doesn't mean that person's suicidal. Doesn't mean they have to get them to the emergency room. But any, like Nina said, the major things are major changes in behavior for them. You know, if they were outgoing, if they went to the youth center, the elderly center twice a week, and now they're not going at all. They used to go for a walk with their neighbors. Now they aren't doing it. That kind of thing. They're not eating. Meals on Wheels people are great because they can kind of tell us sometimes if somebody's eating. The postman. We'd love to train postmen because they know if the person's picking up their mail or not.
Well, of course.
I mean, very simple
wouldn't
things
have
like
thought
that. Yeah,
Sure.
very simple things like that. So we want to educate everybody. So the more people who are looking out for somebody, the better off we are.
All right.
So,
postmen, grocery people,
oh, hairdressers.
hairdressers.
Right.
How many of us go to hairdressers? They're perfect.
Right.
You know,
And if you're
canceling
going to the same
appointments.
hairdresser every 5
That's
weeks,
right.
and all of a sudden,
That's right.
you're not going, and you're not returning phone calls.
Again,
and
changes in behavior for that
Right.
person is really kind of what it boils down
So that's
to.
the key then. That really is one key thing for our audience.
Mm-hmm.
Whatever was the so-called norm
That's
for
right.
the person,
Yep.
that changes.
Right.
Yeah, and not
That's-
just one thing. I mean,
Yeah,
obviously
but
you're
the
looking
norm.
for a bunch
Sure,
of different
because-
things,
right. Sure.
and obviously the sadness, the things that go along with depression. Anyway, being tired, not enjoying things that they used to enjoy. I mean, that whole thing. And as I said, you know, it's not one thing, but when you start noticing one or two or three, and if you think back, oh yeah, they haven't really been that happy. They've been kind of sad and withdrawn and that kind of stuff. Then you can just say, and talk to them. That's it. Just go over to them and say, I've noticed these changes. What's going on? Tell me how you feel.
And if they are, if you do, we say go with your gut. Your gut's usually pretty right, but 80% of people who die by suicide do warn others or leave clues somewhere with someone. It may not be with the family. It may be with the neighbor that is an acquaintance and you really don't talk to that much. Or it may, usually they do leave some sort of something. So when you do hear something that, makes your antenna go up, we say, you know what?
Ask about
Coupled
it.
with the other things that you might see, kind of take that puzzle and put it together and go, okay, and that's when it's time to ask.
So learning to trust your gut, though, with some clues that, unless you're educated about those clues,
Right.
you don't grasp the issue. You don't grasp the issue unless you have some education.
Yes, you're right.
ahead of
You're right.
time.
I think when we
You
go
know,
out,
it's
when we go out, most people know
tricky.
all these warning signs. We have pages of
Oh,
warning signs
okay.
and risk factors. I can tell you that most people know what they are. They just don't see them wrapped up in risk factors for suicide.
Okay.
They see them as changes in personality, or they're having a problem with this relationship, or I know they've been tired, or whatever it is. And they know the signs. They just don't see them in the way we present them, which could lead to, unfortunately, suicide. So,
And in some of our trainings, we talk about essentially what is ageism, and that many people will, well, you know what? Yeah, that's just part of getting old, and that's just,
Yeah.
and no, it
No,
isn't.
and
No,
it
it
isn't,
isn't.
right.
And so to educate people, the true normal, what is in the normal aging process? Depression in aging is not.
It's not
normal.
normal.
It's not normal. Could it be common? Maybe, but it's not normal.
right.
So.
Those are good points you're bringing up for our audience, and as reminders to ourselves too, because in the busyness of everyday life, I mean, you have not only your son or a daughter or a parent. I mean, life is complex and complicated, so you have to have your antennae up.
You do.
To be able
You
to
do.
pick out those clues. Something's different. Something's not right.
Right.
And one clue by itself might not mean something, but
That's right.
putting things together.
Yeah.
Right.
Or even talking. We often recommend, if you have an elderly who's in a facility, for example, talk to the nurse, talk to the Meals on Wheels, talk to the receptionist. A lot of times if you talk to other people, you can get either input that does verify what you're thinking or concerned about. And other times they'll go, no, we haven't noticed any changes. So it's a good thing to check with other people too, just to kind of get their input and see if they've noticed anything. And a lot of times when you do that, they'll go, now that you mention it.
Now that you mention it.
So we want to get people talking before anything happens, before there's any suicide. And a lot of times that doesn't happen until after. So we're trying to encourage people to just give it a little thought and do it beforehand.
Are you seeing from your perspective, because you're working in the field, are you seeing from your perspectives that there is an increase in awareness of these issues, or is it just the same as it's been?
No,
or?
I like to think that I've been doing this about 7 or 8 years, and I think there are more people who talk about it. It's still the stigma of suicide is just horrendous for survivors. There's so much shame and guilt.
Let's
and
talk about the stigma then. Let's
yeah,
talk
a lot
about
of that goes back to the way it was handled religiously, very honestly, hundreds of years ago. You know, somebody, and still today, a lot of people think that if you die by suicide, it's a sin, it's a mortal sin. And that's good in a way, because that can help somebody not die by suicide. If they really have been brought up to think, I'm going to go to hell if I die by suicide, that's a good protective factor. They won't do it because of that. So in one way, it can work to an advantage. I think the stigma comes around from a lot of different angles, but I think, as we were talking about before a little earlier, a lot of people see that people who die by suicide, it's a choice. That there had to be something wrong with them, or there was something wrong with the family, or there was something wrong with the way they were brought up, or something along those lines. And it's not a choice. It really, it's not like somebody gets up and says, it's just not worth it. It goes on usually for a while. As I said, it's very difficult to educate other people, because people who are depressed, clinically depressed, can hide that really well. So you have to get that antenna up a little bit more. But the stigma, I think one of the biggest things with stigma is it stops people from getting help. They are afraid to admit that there is something wrong, because maybe, particularly elderly, if you think about elderly, when they were growing up, they didn't share outside problems with people.
No, they did not.
If there was something mentally wrong with them, they were considered nuts. And we've had a hard time dispelling that myth. And a lot of times they also went to psychiatric hospitals, maybe never to be seen again.
That's right, too.
So to get the elderly, today's elderly, to actually open up sometimes can be very difficult. We hope that because of all what Samaritans and other suicide prevention organizations do, that maybe 10, 15 years down the road, when I'm in a nursing home, well, maybe more like 40 years from now, but when the younger generation, as they get older, maybe they'll be more open to it. So I think that's the biggest stigma
I think you're
problem.
right about that. I think the current population, they're very stoic.
Right.
You keep things in the family.
That's
You don't
right.
air dirty linen. If I've heard that once,
That's
I've heard that
exactly right.
100 times.
You pull yourself out by
That's
the
right.
bootstraps.
That's
Yeah.
right. You want
Just to add on to that, 80% of people that die by suicide are also males. And so there's also that stigma that goes along with males being strong and not having those weaknesses and not being able to talk to other people. If it's a woman, you can call up your girlfriend and talk
right,
about it for 2 hours. But
Right.
Good point. Yeah.
males have a different sort of relationship with that.
And unfortunately, the stigma then it affects, the person from possibly getting help, because they think they need to be strong and they need to whatever. They're going to be sent away, never to be heard from again, like Aunt whoever, 70 years ago.
But those things really did
It
happen.
did happen.
I've gone to
Absolutely.
Danvers State or
Right.
Worcester State,
Well, they
and that
remember
was
that
it.
electric, the electric.
old EC.
Yeah,
one
CCT.
flew over
Right.
the-
Yes.
Yeah, one flew over
yes.
the cuckoo nest. Yeah.
Doesn't happen like that
I
anymore.
know it doesn't happen anymore, but they still remember that.
Absolutely.
Right.
Absolutely.
HMOs kick you out now. You don't get to stay.
It's hard to get into the hospital anymore. Yeah.
That's true.
So the stigma affects that, and then if a suicide does occur, it affects,
The family.
because if that's how you've been raised, or that's the climate of your family, or now you're thinking, well, was that person really crazy? And how can does that affect me? And does that,
How could I have missed it?
what did we miss? Am I crazy for not missing it? What did I miss? How did I, and is it my fault? And did I do, well, what if the what ifs? The why is a big one, but the
Why.
what ifs. What if I didn't say this? Or what if I said this? Or what if I didn't go there, or what if I did go there? What if I didn't have that fight? What if I didn't say that, you need help, or but we liken it to, if you think of, this mug of water. It's, every issue that affects this person, who again, 90% of the time is dealing with something, it's a drop. And so finally, Deb mentioned the perfect storm. So it's that one final drop that makes it overflow. And it wasn't the fault of that one drop, but that might have been just
It was a
the one.
combination of a lot of
It's the
different
culmination
issues,
of
right.
everything. So, yet family members may not even know that. So how do So in terms of that stigma, it affects family in so many different ways. They're dealing with it themselves. It's such a unique. You really do struggle with it, because the person that you love and that you miss is the person who did it. And how do you grapple with
not
that?
blame him, but be angry at the same time, and
But then
forgive him?
And then when you learn that that they were in such a heartache, having such a physical
Emotional.
manifestation of this emotional pain, how are you angry at that?
But you must have some angry feelings anyway.
I can speak for my family. I can speak for me, but I sometimes get angry at the situation. To watch my parents, grieve my brother. He, was my only sibling. So, to watch going through this, walking through this, and it is a journey, and it changes, and I remember early on someone said to me, you know what, you don't really get over a suicide death in the way that maybe some other deaths, a natural death, a grandparent that dies in their 90s, that perhaps you get over that, or you can kind of make peace with that. But I think any type of suicide, any age, it is a tragedy, because you know what, they didn't have to die that way. They didn't have to die that way. If 90% of it is generally, can get help, can get treated, then you didn't have to die that way. So,
But they did.
right, but they
did.
did.
So
And
now
we are left
and
to,
then there are people left behind who have to find a way to deal with it and come to some type of peaceful resolution with it.
They have to eventually accept what's happened, and once you get to the acceptance, I think you can. And I agree with everything that Kim said. Suicide grief is very complicated, because I think there are some aspects of suicide grief that there aren't in other kinds of deaths. Guilt particularly, and shame. Survivors feel very judged. Now, my husband happened to die by a heart attack. I didn't feel judged. I mean, nobody said it was my fault. I should have known, or he should have known. But somehow people judge you when it's a suicide. They
and
judge the
sometimes to
family
your face and
members.
sometimes not. But
Right,
sometimes
right.
it's
Sometimes
good.
to your face.
Oh,
People
I
actually will.
Thank goodness it
Horrible
hasn't
things.
happened to me, but I know other
Horrible
suicide
things.
survivors that, literally, well, that you killed your father, right? Just horrible
Or
situations.
he's not in heaven now because he did this.
Right.
Oh my heavens.
Yeah, they can get very, very complicated for survivors. And people I don't think mean to. In fact, we've put together at Samaritans, which I'm hoping helps a lot of people, we actually put together a whole list of things that friends can help survivors get through this. Because they have such a hard time. That stigma doesn't die with that person. The family
Right.
goes through a lot of stigma as well.
Right.
Judgmental people,
Right.
they get ignored by people. Because they don't know what to say, and they think, well, rather than upset them, I'll walk away. Makes them
A
feel
lot of it's
invisible.
ignorance, I think.
Yeah.
Well, there's the ignorance in not knowing what to say, so maybe they don't say anything and then they withdraw.
That's
And then
right.
Okay,
That makes us feel worse.
That
That
makes
makes-
it feel
that
worse.
makes you feel worse.
Absolutely. We always say, just ask, how are you doing?
How
just
you
say
doing?
something. Hi. How are you doing?
How are you
It's
doing?
better than just pretending that person's not there. You make them feel
Right.
like they aren't important. Like there's.
We feel like there's a giant elephant in the room. Okay, you know what happened, and I know you know what happened, but you're not saying anything. So,
Yeah.
what, and then that makes me feel uncomfortable. And and no, you know what? You're not going to upset me if you mention my brother. In fact, if you have a story about him, I want to know. We want to know. So, you can't upset us any more than we've already been upset. So, so it's share that with us, and we want
Yeah.
to talk about him. And and if you don't, that's okay. It's okay.
It's
but
okay.
but it at least recognize it. At least recognize, that
Just
He
like you would
died.
with any
Yeah.
other
He was
death.
a person, he was a
Right.
loved person, and he died.
Right.
And we
Right.
like people to realize that it's not how the person died, it's their life that you should be talking about.
Right.
I
This
think
one act didn't define them.
That's right.
Didn't
That's
define
right.
their life, because their life was just as important to everybody else's as anybody's.
We're going to be winding down in a couple of minutes, actually. But you said something earlier about the way some religions in the past have maybe taught people how to feel. It's different now. They don't go to hell.
Right.
I mean, I think most religions understand that there's some pain that was just too great to bear.
Well, going back to your earlier question, I do think not only people but religions are also accepting that it really is a mental health issue. It's not, again, it's not that they got up and chose to do this. Really, they aren't in the same frame of mind as other people, and
They just don't know another way out.
I mean, and let's look at Japanese. Harikari is still accepted
That's
as
right.
a
That's
noble
right.
way. So I think it depends on your religion and your culture, which obviously has a big effect on people and growing up and stuff like Kim was saying. But that's what makes me believe, to get back to your other question, I think we are making progress. I do think survivors, with our services that we have, which 20 years ago a lot of survivors didn't have anybody to go to. We've got tremendous things, not only our Samaritans, but other Samaritan offices and other organizations. And we really put a lot of effort into helping our survivors get through this.
Do you have groups for them? I mean, some people might do well in groups or individual work, or what do you find?
We actually have 3 Safe Place groups, which are survivors support groups. They're run by peers, so they're all run by trained survivor facilitators. We have one in Lowell, we have one in Andover, and we have one that just opened in Beverly.
Okay.
And then we also have a Survivor to Survivor program, which is really great for people who aren't comfortable in the group setting yet. And we have trained survivors that can go meet the survivor and just have like a one-on-one conversation.
Some of them might
with
feel more comfortable if you went to the home.
Right.
too.
Yeah,
And it
it's
can be
more
anywhere.
it's safer for them, and then
Right.
they can invite whoever they'd like
Yeah.
to be there. So yeah, we've been doing
And
a lot of
just to answer
those.
questions, my family did that, and it was a huge help. But the groups are wonderful too, because they're not structured, and it's talk if you want to talk, be quiet if you want to be quiet. If you need to sit there and cry, we'll pass the tissues, and that's it. And that's all it is.
And we also have the newsletter.
I was just going to say that
Which is
myself. There's a wonderful
brand
newsletter.
newsletter.
And as I close the program, I guess I want to hold up this newsletter. It says Journey with Hope. Something important for the family members and the friends
Absolutely.
and the barber and the hairdresser and all
right.
these people who knew the person who passed away.
Right.
Because they're grieving too
They're
in their
all
own way.
survivors,
And
that's right.
I wonder how many of them actually talk to each other and help each other out.
Right, right.
That's
you
what
know,
we do
'cause
with
if
our
it's a
survivor
private
groups.
grief,
Absolutely.
in a way.
Absolutely.
Do you, we've got so much that we've talked about in such a short period of time, but I think we've covered such good territory. There's this Journey with Hope, there are brochures. We will have a list of resources at the end of the program, and I want to thank all of you so much for coming today and sharing your experiences and your knowledge and your wisdom.
Oh, thank you.
Thank you
for
very,
having us
very
here.
much, very
Thanks
much.
for giving us the opportunity.
Thank you.
Appreciate it.